Contents of the axilla. Here, this is the anterior wall. The lower border of the pectoralis major, which forms the anterior axillary fold. Like that, in the posterior wall, you see the border of the latissimus dorsi, and this border forms the border of the latissimus dorsi. This forms the posterior axillary fold. So usually here base is removed and we reflect the anterior wall. Whatever you see, two muscles, major and minor. Now we can see the contents of axilla. So if you see the contents of axilla, the main contents are axillary vessels, vein and artery, and infraclavicular part of brachial plexus, and fat, lymph nodes and lymphatics. So these are the contents of axilla. Now here we can see some contents are present along the medial wall, some are along the posterior wall, some contents along the lateral wall, some contents are present along the anterior wall. So along the walls we see the contents of the axilla. Here we can see along the anterior wall of the axilla what contents we can see here. So here we can see the one nerve. This is piercing the pectoralis minor, so medial pectoral nerve, and this is piercing the clavipectoral fascia. This one is the lateral pectoral nerve, and this one is the acromiothoracic artery, and this is the cephalic vein which is draining into axillary vein. So these are the contents along the anterior wall of axilla. Now we see contents along the medial wall of the axilla. Along the medial wall of axilla, what contents we can see here? Here axillary vein is cut and reflected medially, and along the medial wall you can see here lateral thoracic artery, and the most important nerve which is supplying the serratus anterior. This one is the long thoracic nerve or narrow to serratus anterior muscle. And also from medial wall, one nerve is piercing the second intercostal space. Okay, this one, and this is the nerve which is piercing the second intercostal space, supplying the skin of the arm. And this one is called intercosto-brachial nerve. Now we see the contents along the posterior wall. So along the posterior wall we can see here, okay, first this one artery, and this is the nerve. This one is the nerve to latissimus dorsi, and that is accompanied by thoracodorsal artery. And also along the posterior wall we can see this nerve is supplying the teres major, and also this nerve is also supplying the subscapularis muscle, and this one is called lower subscapular. And from above we can see one more nerve. This one is the upper subscapular, and whatever you see big branch from the axillary artery, this one is the subscapular artery. So along the posterior wall, nerve to thoracodorsal, lower subscapular, upper subscapular, and subscapular artery. And also we can see along the posterior wall here axillary artery, axillary nerve. That nerve is accompanied by branch from the axillary artery. This one is the posterior circumflex humeral artery. So axillary nerve and posterior circumflex humeral artery. These structures we can see along the posterior wall. Now structures along the lateral wall. So along the lateral wall we can see continuation of axillary vessels, vein and artery, and also we can see the continuation of brachial plexus, infraclavicular part of brachial plexus. So along the lateral wall here we can see branches of the cords of brachial plexus. Here whatever you see, this one, first one, this is the medial cutaneous nerve of arm, this one medial cutaneous nerve of forearm, and this one ulnar nerve, and this one median nerve, and here One nerve is piercing the coracobrachialis muscle. This one musculocutaneous nerve. And behind the axillary artery, you see the one nerve. This is the continuation of posterior cord, a radial nerve. So these are the contents of axilla.